So let's go over all of the external structures of the eye that we can see from the outside without having to dissect the eye. So first of all, the eye is protected by the eyelids. There's going to be an upper eyelid, the larger eyelid, and the lower eyelid, the smaller eyelid. They are operated by really thin muscle inside of the eyelid. There's two muscles. The muscle that closes the eyelid is called the orbicularis oris muscle that goes in a circular pattern around the eye. And that muscle that elevates the upper eyelid is called levator palpebra muscle. We studied it in the skeletal muscle unit of this course. Both eyelids have eyelashes. The hairs, the special hairs, are all along the edge of the eyelid. The eyelashes on the upper eyelid are larger than the lower eyelid. The eyelashes protect the eye from any kind of dust that from getting into the eye. An additional hairs that are similar to the eyelashes are going to be the eyebrows. These are kind of like thicker, coarser hair than our scalp hair or body hair. They grow along the upper border of the eyelid. This is called the eyebrows. The eyebrows protect our eyes from any kind of usually like the sweat dripping down our forehead or any water dripping down our forehead, so from dripping into the eyes. The corner of the eyes is called the lacrimal lake. Lacrimal means tears. It's got this pinkish tissue. The white of the eye is called the sclera, and this is what the eyeball is made out of. Eyeball is spherical. It's located inside of the eye sockets, and a portion of it is visible between the eyelids. The colorful portion of the eye in this picture, it's bluish, is called the iris. Iris is a muscle. It's a smooth muscle, and it controls the size of an opening, this black structure. This is actually a hole. Yes, it's an actual hole into the eyeball. This is called a pupil, and the iris controls the size of a pupil. It can open it wider or close it tighter. When the pupil is closed tighter, like a smaller hole, it happens in a bright light like here, and the pupil can actually open wider by the iris muscle when the light is dim, so that more light can get inside of the eyeball. Okay, and on the top of the iris and pupil, there's this dome looking like structure called cornea. Cornea is clear so that it can allow the light to pass through and get inside of the pupil. So cornea actually helps to gather light and focus it in the center of the pupil. It's the first lens of the eye. There is also another lens inside of the eye. It's actually called the eye lens. It's located right behind the iris and a pupil. So if you go into the eye through the pupil, there's going to be a lens. It's also clear in color, so we cannot see it in this picture. If you look at the surface of the cornea, it's going to have tiny little blood vessels on it, and it's actually going to appear shiny. If you look at the surface of sclera, the white stuff, you're going to see a lot of these little blood vessels, and also the surface of the sclera is going to appear shiny. That is because the surface of the sclera and cornea is covered by very thin transparent tissue called conjunctiva that contains these blood vessels that nourish the surface of the eyeball, and they also have special glands inside that produce mucus for lubrication of the eyes. So like when we blink, that mucus lubricates the eyes, but also helps to kind of like wipe the surface of the eye, because mucus is sticky and it attaches dust particles to itself. So when we blink, we wipe some of the mucus containing the dust particles, and that clears the surface of our eye. The tears can also help with that too. If we get like too much stuff in our eyes, the dust in our eyes, we can get tear or lacrimal reflex stimulated. That will produce extra tears to rinse the surface of the eye. The mucus can be seen as like the gunk, the mucopia that collects in the lacrimal lake of the eye. That is the mucus that is produced by conjunctiva. And the mucus is also produced by the underside of the eyelid. So if you like flip the eyelid under, inside out, and you're going to see that it actually has lots of the blood vessels too. And that surface also contains the mucus glands that produce mucus for clearing the eye, and they also contain the sebaceous oil glands that produce oil, and the oil helps with the lubrication of the surface of the eye, especially when we blink. The next, we're going to be going over the lacrimal apparatus of the eye. Lacrimal means tear, so this is the tear-producing structures of the eyes. These structures are located inside of the skin and inside of the even bone surrounding the eye. The lacrimal apparatus begins with these glands called lacrimal glands. These are the glands that produce tears, and they're located right here in this kind of like slightly fatty portion of the eyelid. It's gonna be the lateral upper corner of the upper eyelid between the brow, so under the skin and muscle of that portion of the eye. There's going to be lacrimal gland, and it's going to have little tubes called ducts connecting it to the outside of the upper eyelid, its lateral corner. So right here, if you look closely at your eyelid, if you kind of look at this edge but on the upper eyelid, you're going to see that it has tiny little holes in it with these ducts that are opening to the outside. So it's kind of like a shower head that releases the tears onto our eyes. So we actually cry our tears from right here, from the lateral corner of the upper eyelid. The tears are meant to rinse the surface of the eye from any kind of dust, and we also cry when we feel extreme emotions like sadness, anger, and even fear. The tears can also be used to rinse the inside of our nose, actually, because a lot of times when there's kind of dust in the air, our nose also is sensitive to that. So to help rinse the dust or allergens from our eyes and nose, the tears are produced. How do the tears get inside of our nose? They actually have two canals that open into the nasal cavity. This is called the nasolacrimal duct that opens into our nostrils, and it is connected to the corners of the eye through two tubes called superior and inferior canaliculi. And there's going to be two little holes on the medial corner of the upper eyelid and the medial corner of the lower eyelid that lead to these canals into the lacrimal sac first. It's going to be located inside of the lacrimal bone, and then into the nasal cavity through the nasolacrimal duct. The tears help to clean and lubricate the eyes in response to an irritation of the eyes. They contain natural antibacterial substances too. Here's the structures. Here's the pupil, the next structure that we study. The pupil is a hole in the center of the iris. This is a pupil at various stages of dilation. When the pupil is small, it is referred to as constricted pupil. When the pupil opened wide, this is called a dilated pupil. A pupil is a hole, and the iris is a muscle that controls the size of a pupil. Pupil is constricted when there is ample ambient lighting or if there's bright light. Pupil is dilated when there's little ambient lighting or dark conditions to let the light in. The pupil dilation can also be attributed to the emotional state. When we are excited or interested in something, our pupils dilate a little bit more. In addition, certain substances like stimulants like coffee, alcohol, drugs can dilate the pupil and prevent its constriction when the light is directed at the eyes. And this is one of the tests that is used by the let's say police officers that pull over drivers that they suspect are under the influence. They can flash the flashlight into their eyes and observe the pupil reaction to that light. If the pupil is dilated and it doesn't constrict fast enough or at all to the light, to the bright light, that means the person is under the influence most likely. In addition, the pupil gets dilated if a person hits their head and gets like a brain damage to medulla oblongata. The pupil can remain dilated and not respond to the light. That could indicate brain damage or even brain death. in an unconscious person. So medical professionals, they shine a light into an unconscious person's eyes to see if they respond to light, because if a person is unconscious but there's no brain damage, the pupil should constrict regardless. But if the person experiencing a brain trauma, like a brain damage, or possibly even person is dead, the pupil will not constrict in response to light. So the cornea is the structure that covers the pupil and the iris. It's this clear dome-shaped structure, and it allows the light to pass through and go right into the pupil. So it helps to gather light into the pupil. If the cornea has some kind of damage to it, a person could lose sight or have bad vision. The cornea could also be abnormally shaped. That could make the vision blurry. And a lot of people wear contact lenses on top of the cornea to correct the shape of the cornea and help them see more clear, more sharp, because cornea is what makes the picture sharp and clear for us. If the cornea is not shaped correctly or not shaped precisely round, then we can get a blurry vision. The color of the cornea determines the color of our iris. So if the cornea has melanin in it, like the pigment that makes our skin brown and makes our hair brown too, that's when the eyes will appear more dark, more brown. If there's less melanin, the eyes will have more color to them. Here is the physiology of astigmatism. This is astigmatism as opposed to the normal eye. Astigmatism is when we don't see the clear edges of shapes and objects around us. So the images appear to us blurry, especially in the distance, as opposed to the normal eyesight. When the light enters our eyes, it has to pass through the cornea and then enter the iris. Then it has to pass through the lens behind the iris and then focus in the back of our eyeball cavity. In the back of our eyeball cavity, there's special neural tissue called the retina containing the photoreceptors and the optic nerve that directs these sensations into the brain. So there is a focal point right above the optic nerve where the light has to focus precisely on. If the cornea is not shaped correctly, it's a little bit more extended. So imagine like the tip of the football. So it's a little bit more kind of like extended, like it is opposed to like round. This picture doesn't reflect it too much, but basically what happens is that the light passes through the cornea and it breaks up into a couple of the focal points, creating several pictures that slightly that don't overlap well, and that produces blurry vision. So this is kind of what it looks like with astigmatism at night as opposed to without astigmatism. If a person is looking at the bright lights, they have these lines or halos coming from them. Okay, you can actually achieve this effect by squinting your eyes, and squinting your eyes changes the shape of the cornea, producing these kinds of aberrations, these kinds of halos around the lights, as opposed to without astigmatism. So this picture reflects the shape of cornea differences between astigmatism and normal cornea. So normal cornea has got this round shape to it, and astigmatic cornea has a little bit more elongated, extended shape to it towards the front. It's called oval-shaped cornea, producing multiple focal points as opposed to one focal point. So here is kind of the comparison of the cornea. So normal cornea will have round shape horizontally and vertically, and the astigmatic cornea will have kind of like, it could be exaggerated shape this way normal, this way more extended, or if you flip the football pointy part forward, it's going to be more extended towards the front. So there could be lots of different variations in the shape of cornea, but if the cornea is not round, it's going to produce these aberrations and blurry vision. So let's review the external anatomy of the eyes. The eyes have eyelids. Eyelids are called palpebra, by the way. There's upper eyelid and lower eyelid. Eyelashes, they are hairs growing on the edge of the eyelid. Eyebrows is the line of hair growing above the upper eyelid. Sebaceous gland will be located under the eyelids, on the underside of the eyelids, producing oil for lubrication. Conjunctiva, it's the clear tissue containing mucus producing glands and blood vessels that covers the surface of the eyeball. It's shiny, it has these blood vessels, and underside of the eyelids. If conjunctiva gets an infection, it turns pink. Okay, it's called a pink eye or conjunctivitis, and it could be treated with antibiotic if it's bacterial, or basically kind of have to wait it out if it's viral. Lacrimal lake is the corner of the eye containing the ducts into the lacrimal sac of the nasal cavity. Sclera is the white of the eye. It makes up the entire eyeball. It's the white connective tissue. Iris is the colorful portion of the eye. Pupil is the dark hole in the center of the iris, and cornea is the clear dome structure that covers the iris and the pupil. Let's review the internal anatomy of the eye. So this is the eyeball. The eyeball is made out of sclera. The eyeball is round in shape. And in the front, the sclera becomes more clear and turns into the cornea. So cornea is that dome-shaped structure that covers the iris and the pupil. There's going to be a little bit of a space between the iris and the pupil and the cornea. This space is filled with liquid called aqueous humor. And the chamber itself, the space itself, is called the interior chamber because it's located to the front of the iris. The iris is a muscle, so in the cross section they drew it red. Behind the pupil, the hole, and the iris, there is a clear gumball shaped structure called the lens. The lens is attached by the muscle to the perimeter of the eyeball, to the circumference of the eyeball. The muscle that connects the iris, it's actually all the way around the iris. The muscle that connects the lens to the eyeball, to the inside of the eyeball, is called ciliary body. It's actually goes all the way around the lens, not just on the edges. It's all the way around. The ciliary body is a muscle. It's a smooth muscle, and it can change the shape of the lens, allowing us to change our focus from shifting it to close up to the far away. It's called the near point accommodation.